So for our wheelchair athletics return to sport update and Q&A session, we have Gail Hamamoto on the line as well. She is our executive director, and she will be able to provide some guidance throughout the webinar as well. And we have a lot of people on the line, which is really great to see. So a lot of our provincial coaches, Garrett Collier and James Hoosfit, and some of our regional coaches, which is really great to see, and some of our other regional staff. And we have Michelle McDonnell as well from wheelchair tennis at BC Wheelchair Sports, and Nathan Bragg, who is our communications coordinator and actually just finished up on a wheelchair rugby return to sport webinar. So we're really grateful to have everyone with us today. And we actually have one more face joining us right now. We have Sarah Black from Athletics Canada, and she is the para-performance manager with our national sporting organization. So we are very grateful to have everyone today. And so really to start, the purpose of our session today is just to gain some clarity around where we are in our return to sport, and just address where we are and kind of the steps that we'll be taking to ensure a safe return. So if there are any questions along the way, there should be a chat bar at the bottom of your screen. So please feel free to ask your questions there, and Gail will be monitoring those questions. So we'll address them as we go through, but also there will be an opportunity at the end to answer any questions that you may have. So to get started, we will just start with a few definitions just to gain some clarity around what we are talking about today. So today we're really talking about organized sport. So sport is defined as any organized sport activity that involves a number of people doing a physical activity together in a structured way, and it is facilitated by a provincial sporting organization such as ourselves, or local sport organizations. So from the photos there, you can really see sport is any of our programming that is sanctioned and coach-led as well. So that is what we're talking about today. And then some other definitions that may have come across in return to sport readings is recreation and physical activity. So a little bit different than sport, but recreation is freely chosen participation in physical, social, intellectual, creative, and spiritual pursuits that enhance individual and community well-being. So similarly, physical activity is really anything around leisure, fitness training, and sport-related activities that are done at the discretion of the individual. So that's really the important part. So that's kind of what differs between sport and these two, is that recreation and physical activity, that's on the individual, and it's either self-led or facilitated by recreation leaders, whereas anything sport related is typically sanctioned by your PSO or local sporting organization.
And the reason we're really emphasizing that at the outset of the presentation is that the guidelines and processes that we're going to put in place govern sport. So we are aware that you might go for a wheel in your community, you might, do some activities in your community on your own, and that is obviously your choice, and you sort of assume your risk on that. But if there's things that are led by our organization, then all of the information we're going to present next relate to that more defined definition of sport that Anna's laid out.
So in regards to return to sport, that really refers to the process of developing and implementing guidelines for sport organizations to be able to operate safely in BC during the time of COVID-19. So it will be unique to each sport. So even for BC wheelchair sports, it's going to differ amongst wheelchair tennis, wheelchair athletics, and wheelchair rugby, and how we organize and develop our guidelines. But really the key is that it must follow provincial health office orders and recommendations. So again, the next point really just reiterates that it will be different for each sport and each provincial sporting organization and clubs. So again, as mentioned previously, so at this time, BC Wheelchair Sports is not funding, endorsing, sanctioning any organized sport activities. So that means if we're paying for a program or paying for a coach to coach any of our athletes at this time in person, that really can't take place right now, but that is something that we are moving towards. So any individual activities, including, but again, not limited to, recreational athletics and personal training, those are at the sole discretion and risk of the individual. So again, not sanctioned by us, it's at the sole discretion of the athletes and coaches. So just a little bit of a timeline to recap where we've been in the past few months. On March 13th, BC Wheelchair Sports suspended all sport programming, so for all 3 of our sports, until further notice. And that wasn't really with following any guidance from the provincial health office. It was more so out of caution for our community and staff. So we kind of took that upon ourselves to initiate that for the safety of everyone. And similarly, BC Athletics announced event cancellation and postponements in BC and outside of BC for really any of your track and field meets and competitions. So from March 20th, we extended our programming suspension until May 30th. And that's kind of where we realized that we're going to have to take a slower approach and start working around figuring out how we can return to sport safely. March 23rd, Athletics Canada announced postponement of the 2020 Olympic and Paralympic track and field trials. So those are your Canadian track and field championships. May 19th, the province of BC moves to phase 2 of the provincial restart plan. So we will talk about that a little bit more in the slides to come. And then May 30th, we've extended our suspension of programming until June 30th, so the end of this month. And with that extension, we will reassess where we are at the time. So it doesn't mean that we won't go back, or we might go back, but it's just about having more of a discussion around that time and seeing where we are at that point of time. June 1st, 2020, the sector, so Via Sport, released their return to sport guidelines, and as well Athletics Canada published their back on track guidelines. So those are really 2 of the bigger documents that we will use to guide our development in our wheelchair athletics return to sport guidelines, as well as anything from the provincial health authorities as well. And finally, June 10th, the government has created a ministerial order that protects amateur sports organizations, their employees, and volunteers from liability. So that's a really, really big one, and we can touch on that, I think, in one of the slides to come, but that's an important piece in all of our return to sport. So BC Restart plan, as of today, we're still in phase 2. I know on the slide it actually shows phase 1 today, but we are currently in phase 2. So that means restoration of some services under enhanced protocols. And again, that's where recreation and sport falls under. So again, that doesn't mean that we specifically are returning to sport as we are in phase 2, but that just really means that maybe some rec centers and different municipal facilities are going back to some form of recreational play. And it's really kind of under the BC Recreation and Parks Association, who have also developed their own guidelines for those. So Via Sport, again, our provincial sport body, they in their guidelines have provided sport activity phases, as you can see in the chart. So it really outlines what we are moving towards. So it's a bit of a phase chart. So as you can see, it starts with stricter controls and then moves to transition measures. And that's currently where we fall under. So approximately May 19th to September. But although, as you can see, that we're leaning towards a progressive loosen and a new normal with BC Wheelchair Sports and our return to sport guidelines, we might fall a bit different in these phases as we take a slower approach to returning to sport, and we just need to recognize that not all sports are returning at the same time, and even the same sports for athletics, able-bodied athletics may return before para and wheelchair athletics. So we're really just looking at putting the health and safety of our community and staff first. So the transition between these phases just might move a little bit different than what's seen in the graph. So where we are now, again, all three of our sports are working on developing their return to sport guidelines. But specifically for wheelchair athletics, we've made a little bit bigger of a jump recently in those guidelines. So we are working on the guidelines as well as waivers, release, and any acknowledgement of risk. There will be a COVID-19 screening questionnaire and declaration, an illness policy, and as well as an outbreak plan. We've also been consulting with Lisa Myers, who many of you know. She is the wheelchair racing coach out in Ontario with the Cruisers Track and Field Club. And we've been bouncing ideas off of each other and really just sharing information between the two provinces to further the enhancement and development of our plans, and really just to make sure that we're servicing our athletes and our coaches. And just recently today, actually, BC Athletics published their return to training addendum. So that can be found on their website, and that is also something that we will work closely to align with wherever we can.
And so just to provide a little bit of context around that, we had to wait until VIA Sport had released their return to sport guidelines for the sector as a whole before we can finalize our own guidelines. So those were just recently released, and we want to make sure that we are in alignment with our sport partners like Athletics Canada and as much as possible BC Athletics, so that those of you who are in the athletics community aren't working with vastly different guidelines across your sport responsibilities. And so we're really looking at it from a para lens, and what additional responsibilities and duty of care do we have to our athletes from a para perspective that may not necessarily be covered off by our partner organizations. So alignment and then some enhancement and augmentation of those guidelines.
Yeah, and I think with that too, with the lens of para and para athletics, we're just really recognizing that you can't categorize all para athletes and the guidelines to look the same. So we're really just taking it on an individualistic basis and making sure that we're accounting for all of our athletes and what their sporting opportunities might look like compared to their teammates. So we recognize that some guidelines may differ in terms of para athletes and para athletics. So this is a little bit more geared towards our programming on the Lower Mainland. We recently had a conversation with the Richmond Olympic Oval, where a lot of our training camps and indoor athletics practices take place. So we met with them on June 9th to discuss the restoring of services, as they are also currently closed. They don't have a specific date yet of when they foresee themselves opening, but it is expected that the Oval will be open to some extent by mid-July. So the Oval is really looking at mitigating risk and following the provincial orders and adhering to developing guidance. So everything from the CDC and Vancouver Coastal Health, WorkSafe, as well as our plans. So they're taking a look at kind of all of the organizations that come in and use their facility. They're really working on making a scalable and adaptable plan, making sure that it can be a continuum of programs and services. So just a slower reintegration of their sports and users. They're looking at reduced facility hours, so assessing the demand of user groups, looking at different group-specific hours, and really focusing on cleaning and sanitization. A big piece is also emphasis on staff safety, sport system alignment. So they will be looking at our return to sport guidelines as well whenever it is that we plan to use their facilities, and developing a communication plan just to make sure that everyone knows what's going on at the Olympic level. So just in a little more detail, in regards to their reduced facility hours, they're looking at a Tuesday to Saturday model and scattered schedules to avoid booking conflicts. So for example, we typically use the track lanes, which are nearest to the rock climbing wall. So they're really working to see how they can mitigate it so two user groups don't correspond with their booking times. So they've also noted a potential Sunday and Monday booking for our user groups that we can use safely. They've noted access points and infrastructure and safety. So entrances, you can come in through the parkade where they will be checking if you are coming in for a booking, and if not, you won't be allowed in the building. There's an entrance at the lobby and front desk, and as well, we're looking into possible access through the back plaza just to further avoid possible risk through wayfinding in the building. All three elevators will be operational, which is great for the flow of traffic, and staff will be checking in again who's coming in, and you'll be going through booking and screening questions just to make sure that everyone's healthy and safe to be inside. Doors will always be open. Sanitization stations will be located all over the facility, as well as signage and vinyl will be all over the facility as well for easy wayfinding. And then under sanitization and deep cleaning plan, they've really noted that they're working on a continuous cleaning. So they will have staff set up at certain checkpoints to continuously clean while programs are happening throughout the day. So deep sanitization, and they will be using Health Canada recommended products, and as well specific shutdown hours for sanitizing and deep cleaning. So they have noted in their schedule when they will be doing that, and which will be great in terms of when we can book and look around working with those hours.
So one of the things that we've talked about them with is early morning booking, so that we're potentially one of the first user groups in the building before it sort of becomes overrun with other people, or potentially booking on those dates when the building is not open to the public to reduce the risk to our users. If any of you are familiar with the Oval, it's usually chock full of human beings. Right now, they're looking at only 120 to 130 people in the building at a time, including staff, and they showed us really comprehensive diagrams of what all of the spaces are going to look like, and they've already taped out blocks of spaces throughout the whole building that will ensure adequate spacing between each person. So it will look nothing like the way the Oval looks right now in terms of the volumes of people that are going in. Very, very spread out, lots of physical distancing in place, lots of cleaning, so continuous cleaning, and then shutting down the building once or twice a day to do a deep clean again before they reopen it. So deep cleaning more than once a day. In addition to continuous cleaning. And we really are interested in that backdoor access. So the glass doors that are along the back by the river, having our athletes come directly in the back glass door where they can access the track, where you can access the seated throws area, do your workout, and then leave out those back doors. And we're going to be assessing the path on the east side of the building, which we're hoping has a more amenable grade and is paved, as opposed to the west side, which is a fairly steep gravel path up to the dike area. So that, for those of you that do train in the Lower Mainland, I for one was quite reassured by the Oval's plan. The amount of work that they've gone, that's been put into the plan is extraordinary and really quite different in terms of operations for the Oval with everyone's health and safety in mind.
Yeah, I think they've really done a great job in taking into consideration all of their user groups, and limiting who's in and out of the building at one time. So looking at our next steps, once we've completed our wheelchair athletics return to sport guidelines, we will send them off to approval by our board, as well as any corresponding documents. So those are your waivers and illness policy and outbreak plan. Those will all have to be reviewed by the board before we can actually sanction any activity. And so from there, we'll be looking at a phased approach to return to sport in wheelchair athletics. So what that might look like is starting with individual training and coach sessions, and then leading into more small group sessions. And I think really between the two, it's going to be dependent on location and support staff, and if there are other public users at that time. So those might move at a bit different of a pace. Number 3, we'll move into training camps and clinics, and then from there, local competition. And from there, hopefully what will be a new normal and resumption of all activities. So to show that a bit better, we've developed a little bit of a phase chart here. So similar idea in level 1, which would be from March to our present, no sanctioned activities. It looks like individual training, so what you've been doing at home, no in-person coaching, and no access to club-related facilities. So from there, moving to level 2, which potentially could look like July onwards, progressive return to small group training, PSO facilitated, coach-led sessions, and most likely outdoor, but again, depending on the user groups and sharing of fields and tracks, we would look at the possibility of indoor facility training, somewhere likely like the Richmond Olympic Oval. And then from there, level 3, whenever that may occur, progressive return to large group training, return to training camps and clinics, a progressive return to local competition, and then again, outdoor and indoor training. And then from there, what would be our new normal at level 4? That's really dependent on BC reaching a phase 4, but that would include resumption of all sport activities under the new normal. So some key changes in what a phased approach will potentially look like for us compared to how we've been operating before. So again, level 2 will begin following the release of board-approved wheelchair athletics return to sport guidelines. All participants will be required to sign updated waivers, as well as health declaration forms and any acknowledgement of risk for those under 18. Athletes will need to self-certify that they are in good health and not experiencing any symptoms before each session, and athletes as well as any support staff or coaches as well. So that really falls for everyone participating in the sessions.
Sorry, Anna, just interrupt. And this is really, really important, and we're going to talk about insurance later on. But the fact of the matter is, none of us can guarantee anyone else's safety and complete, lack of risk with respect to COVID-19. And so it's really important that we inform our participants, our coaches, our volunteers of the risks, and that they acknowledge those risks and sign off if they are willing to be a part of the program under those conditions. Because as you know, we will do our utmost to ensure a safe environment, but there's always going to be a risk. With the other thing that we're investigating right now is whether or not we can have a satisfactory digital aspect to this, so that we're not passing back and forth pens and pieces of paper between individuals. And we're looking into what technology we can employ to have something that's legally valid. So there are some programs out there like DocuSign that you can insert your signature. And so, you know, in a perfect world, you would wheel up with your cell phone, you would have the waiver or the health declaration open on your cell phone, click a couple of buttons and fire that off to your coach, who would then send it off to BC Wheelchair Sports. So that's the vision. Whether or not, we don't have all of that in place right now, but that's what we're looking to do. If that's not possible, then unfortunately it will have to be paper forms with actual signatures, because we've been advised by legal counsel that checkmark type of form filling is not adequate in this situation.
And then from there, so what participation may look like in terms of group training, it will be limited to a maximum of 5 per sport, so 5 people per sport, and that would be 1 coach to 2 athletes to 2 assistants. So this might make a little more sense in the next bullet point. So at this time, we're recommending that any athletes needing assistance with transfers, either retrieving implements, which is a big one, taping or strapping, get it from a member of their household and not from coaches. So if you do not have a member of your household to support, we encourage you to contact us when we get to that point in time, and we'll look at how to best mitigate that risk and kind of work around what we can do there.
And I think it's really important to emphasize that we don't want this to be a barrier to someone to be able to return to sport. So we are committed to working to find a solution for each of our athletes. We just want to make sure that it's done in the safest way possible. And if that means we get additional sort of creative solutions around how we retrieve implements. Anna and I were brainstorming the other day about what kind of implements could we use to scoop up stuff and bring them back at a safe distance. We'll look into all the different possibilities of what we can do to make it possible for all of you to return to sport in a safe way.
Yeah, and most of our programming is very heavily relying on our volunteers, which we're very grateful for. But again, I think we will get to a point where we can look into having our volunteers back. But right now, it is recommended that we look for members of athletes' households to support in training programs. So sessions will be scattered to allow for arrivals and departures at different times. So an example of this, and it was a great idea that we heard through the Richmond Olympic Oval, but using WhatsApp to let athletes know when they can leave their cars to make way to their training session. So what that might look like at the Richmond Olympic Oval, if you're parked in the parkade, your coaches are upstairs and they've set up their session and they're ready for one athlete to come up, they let you know, next athlete comes up or uses a different elevator, and it's just really to ensure that we're not crossing too many people's paths along the way. All programs will require registration, and all registration and payments will be completed online. So in recognizing that not everyone might be able to complete online payments, we will be able to do so over the phone and figure out a way to do so otherwise. But we are looking to an online component of registration. All of our wheelchair sports staff will follow a new illness policy and outbreak protocol to ensure safety of everyone. And if there is a regression in the provincial phase, this will result to renewed cancellations and just reassessing where we are at that point of time. And then just some other key points in returning to sport. BC Wheelchair Sports is fully committed to the health and safety of our members as we work towards returning to sport. And that's why it might seem like we're taking a bit longer to get there, but it's really because we want to be thoughtful and meaningful in the guidelines that we develop to ensure everyone's safety. So we will get there. We just want to acknowledge that it's also a long-term process and sports will vary in their return to sport guidelines and timelines. And because due to the nature of athletes' disabilities, some athletes will be considered higher risk for a more severe course of COVID. So that's also something that we're taking into consideration when developing our guidelines. All participants must assess their own unique health risks and the safety and preparedness of their local athletics club when returning to sport. So really looking, like Gil mentioned before, if you're ready to return to sport, and if your club and your programming is ready to return to sport. So right now we're currently using the information that we have that's understood as the best practices for participation in athletics for the general population, and then using our knowledge as well as what we've received through medical practitioners to make sure that we take care of the populations that we work with as well. And a lot of the information in our guidelines will be compiled from recommendations published by Athletics Canada with their Back on Track guidelines, via sports return to sport guidelines, as well as provincial and municipal health authorities, and aligning with BC Athletics wherever possible as well.
And just to jump in here, the information has been sort of coming in on an ongoing basis from all areas, and we're trying to keep abreast of it. But there are certainly recognized gaps in terms of the information that we have and what is needed. So as an example, Via Sport is convening a Sports Science and Medicine Council to try and get some more sports science information around return to sport planning. Additionally, at a national level, and Sarah can probably jump in here as well, some of our national chief medical officers, such as Dr. Andy Marshall, are liaising with their counterparts at national Paralympic committees around the world to share information specific to Paralympic athletes and to see what research is out there, what shared knowledge they might have, and then to bring that back to the Canadian sports system so that those of us working in parasport have more information in terms of our community and how we can best protect everybody and keep everybody safe as we go forward through our return to sport process.
So this will be a big piece for clubs and coaches. COVID-19 insurance. Unfortunately, there is none. Currently, no available insurance coverage for COVID-19 related illness, liability, or defense against lawsuits. So amateur sports, that's really why we were unable to provide sport programming during the pandemic. But of course, on June 10th, the ministerial order for protection against liability for sports order came out. So that states that it protects amateur sport organizations and their representatives. So anyone really related to our PSO and clubs, athletes, volunteers from damages resulting directly or indirectly from COVID-19. So it kind of just gives a little bit of an example there. A sports organization or its representatives will not be liable for a participant in their sports program being exposed to COVID-19 as a result of participation. And likewise, that's why we're asking all of our clubs and our coaches, as well as participants, to really follow our guidelines and the protocols that we set out to help prevent the spread of the virus and ensure, again, everyone's safety. So I think Gil can probably talk a little bit more to this.
Yeah, so two really important points on that. One is that liability protection is only in place if you follow the guidelines. So if any of us as administrators, as coaches, as athletes do not follow the guidelines that have been set out, then that protection is not in place. So that's why it's super important that once we publish the guidelines, and we will be having a webinar to explain them to you, that you follow them to a T. There can be no sort of laissez-faire attitude toward this. You know, today we took attendance, yesterday we didn't take attendance, today we're doing social distancing, tomorrow we're not. Like, we just can't do that. We have to do it, you know, follow the guidelines by the letter. First and foremost, to protect everybody's health, and then secondarily to make sure that we're not exposed to any kind of liability, because in the case of a suit, if someone were to get COVID-19 at a training session affiliated with wheelchair athletics or seated throws, and you know they decided to sue any one of us, likely all of us would be named. So right from the volunteer to the coach to the club to the PSO, and so that is something that we need to avoid and not put anybody at risk for that, never mind the health risk that is the priority. The other factor that I'm trying to seek some clarification on is that currently the way the order is written is that it is in place for the length of time that our province is in a declared state of emergency. And at the moment, that state of emergency has, if I recall correctly, has been extended in 2-week increments. And so the question that I did ask yesterday once I saw the order was what happens, or how long will that state of emergency be, if anybody knows, and what happens after the state of emergency is declared over, which conceivably could happen before the pandemic is over. And so then what is our level of risk at that point? So when we get more information about that, obviously we will share it with all of you and make sure that no one's exposed unnecessarily to any kind of risk.
Yeah. And so to that point, BC Ultra Sports, we will work with athletics clubs and any municipalities running wheelchair athletics programming to ensure that there's alignment of facility and BC Wheelchair Sports protocols. So again, we really need to be diligent about following the approved guidelines once they are published.
And with respect to facilities, I think that's a key issue that the sports system is wrestling with right now. So there is a set of guidelines from Via Sport, BC Parks and Recreation Association has set their own set of guidelines, and municipalities have their own set of guidelines. And then you'll have ours layered on. And so that becomes a very complex kind of web of rules and regulations that must be followed. And in our recent Sport BC call, a number of the provincial sport organizations expressed frustration over some key differences between the municipalities, BCRPA and Via Sport, which could affect those of us that are booking tracks through our local recreation association. And so I think really listening to what the other provincial organizations are going through at the moment, it's going to have to be a case-by-case basis where we work with you as a coach or you as an athlete in your community with the organizations that govern your local track facilities and work the various guidelines through so that we are all in alignment. And judging from what I'm hearing right now provincially in the other sports, that's not necessarily going to be easy, but that is the work that we will do so that everybody can get back to track.
Yeah. So from there, wheelchair athletics programs not operated or funded by BC Wheelchair Sports or its clubs are not beholden to BCWSA policy, but nevertheless should take care to ensure the safety of athletes, given that many are at increased risk of negative COVID-19 outcomes. Any unattached coaches are allowed to operate, again, outside of BC Wheelchair Sports' framework, and athletes can make their own decisions around what training to engage in. However, at that point, any participation undertaken at the discretion of an individual is not sanctioned by us and therefore not insured by BC Wheelchair Sports. So really, players are ultimately responsible for assessing the safety and preparedness of their coach club program, as well as their personal health risk related to COVID-19. So if anyone's unsure about returning to sport, or if they're ready to return to sport, and in regards to personal health risk, that's where we can help and provide some guidance. So we really encourage anyone who's unsure, just has questions, to reach out to myself, Gail, and we can help.
And we also recognize regional differences in terms of, let's say, our northern programs, our island programs, our interior programs, depending on how the pandemic evolves in our province and how we progress. So, you know, in the case that one region has an outbreak and we need to be more conservative, then we will look at that specifically. And where there might be another region that has been COVID-free for an extended period of time, we would look at that timeline differently as well. So really making sure that we're recognizing the local implications in terms of programs and services going forward.
I'll just jump in here, just in terms of the unattached coaches. This is a national thing as well. So if you are associated with Athletics Canada or BC Athletics and not BC Wheelchair Sports, you're still going to fall under at least those guidelines. So there's been a lot of conversations this week of kind of finding those wiggle rooms, and you're going to fall under whichever organization either employs you or insures you. And I can assure you that each of those are going to have a policy that aligns with this and with via sport or the national organizations. So it's not as simple as just, oh, I'm unattached, I have no responsibility. It's more that it will fall under potentially different organization. And as Gail and Anna already alluded to, that they've worked off of those national and provincial guidelines to create this, and then enhanced it further for our population groups. So I encourage you to, if you're working with this population, even if you're unaffiliated from BC Wheelchair Sports, that you still utilize these guidelines that they've worked so hard to put together to ensure that both you as a coach are properly insured and covered, but you're keeping your athletes and communities safe as well.
Yep, that's great, Sarah. Thank you so much for jumping in and clarifying that, especially from an Athletics Canada perspective. It really helps. So moving along, just some things to consider as myself and others work on returning to sport. This is kind of just looking from a athlete and coach and club lens of what you can do in the meantime. We have put out our Return to Sport member survey, which I've circulated, I think, to everyone, or just about everyone on this webinar. So the link's there. We're really looking for feedback around any of your concerns in returning to sport and kind of how we can ensure everyone's safety is in place. So I really encourage everyone to complete that survey. And if you can do so prior to Sunday, June 14th, that would be really great. Other things to consider. So again, do you require an assistant to train, which again, most cases right now, it'll look like yes. So whether it's transferring into your sports chairs, so your racer or your seated throws chair, retrieving implements, taping and strapping, looking at who can be that person for you. But again, alternatively, please contact us and we can look at supporting you in that as well. Looking at how you travel to programs. So I know some of our athletes take transit, some athletes get dropped off, but really looking at what's your safest way to come to training. Maybe you got dropped off by a friend before, but now is that friend in your close bubble or a member of your household, and just really taking those into consideration to how you can access training sessions safely. And as well, what other supports, if any, would you need from us in your return to sport? So all of these things are just something to consider, and if you have any feedback from those questions, I would encourage you to put them in the survey, and if not, please feel free to email me as well.
And just to add a couple things to note, the survey is short. So for those of you who are feeling surveyed out right now, I think it's only 5 questions. So please take the time to fill it in. Also, as an organization, we want to be really clear that we recognize this is a very individual situation with respect to individual health conditions, with respect to comfort levels, returning to sport, all of those things. And so we're committed to acknowledging each person's individual circumstances and not penalizing an athlete in any way if they are not comfortable coming back to our program or to a specific session that we might be running. We're not going to say to you in several months to say, oh goodness, you're not eligible for the provincial team because you didn't come to practice. We respect each individual person's decision-making and individual circumstances around whether or not they can return to sport and when they can return to sport. So we will work with you individually. We will take all that into account, and you will not be beholden to a set of strict selection criteria that say, nope, sorry, you didn't meet the training demand and therefore we're not going to select you to such and such a team. We're going to work that through with our coaches, with our athletes, in the fairest way that we can.
Yeah, so really the questions on these slides, again, aren't meant to cause barriers for anyone, but really just something to think about and for us to get a better sense of how we can support your return to sport. So what's next? Wheelchair athletics return to sport guidelines are tentatively set to go through board approval for the end of June. And then as we mentioned previously, from there, once the guidelines are approved, we would look to host a second webinar and Q&A session just to go over those guidelines and be really clear of what we're looking for. What training will look like. So any athletes, staff, coaches, assistants will not be permitted to participate if they're experiencing any symptoms of a cold or flu or COVID-19. And that means if you've had symptoms in the past 10 days, or if you've traveled outside of Canada in the last 14, or if you've been in contact with someone who is outside of Canada in the last 14 days. So that's really, again, just to ensure everyone's safety at the sessions as well as your own. So that will be in place, so that ties along to the screening health questionnaires and declaration forms. Like Gail mentioned, attendance will be tracked, so we'll be looking for names, the dates of training sessions, times, location, all of that, so we have it on file in case there is an outbreak. And I'm gonna sound like Bonnie Henry right now, but we're really looking at fewer faces and bigger spaces. So although we are a smaller group, it might become a little smaller in the time to come, just in terms of, again, what we can facilitate and where we can facilitate it in a safe way. So that's something to look to as well. And so this is what came out with BC Athletics today, as well as our own. So all participants will need to sign our waivers or acknowledgement of risk for those under 18. Again, our health and declaration forms and daily symptom screening forms. A key piece is to make sure that your membership is up to date. So that's both a wheelchair sports membership and Tracky and BC Athletics. So the key here is to be familiar with who completes your BC Athletics and Tracky registration. So for most of us here in the Lower Mainland, that's the WC Race Series Society. So we'll work closely to ensure that all the Tracky information is up to date. Because right now, all of the memberships have been set to inactive, and that's really to reassure that people are reviewing BC Athletics questionnaire and attestation in regards to COVID-19 and their waiver forms, as well as reading their guidelines and just redoing your information so that everything is up to date. So that will also be something to take into consideration, and that was also just released today. So it may be new information that you haven't seen yet. So just also to get the wheels turning a little bit, what we've been looking specifically in our guidelines, specific to both seated throws and wheelchair racing. We're looking to have each athlete be designated their own personal space during training sessions. So this is where they will keep personal belongings and attend to for training and water breaks. And each of these personal spaces will be indicated by cones or pylons. As well, a cone and pylon will be used to indicate where athletes' skate chairs or other mobility aids should be moved to, just again to ensure safety. We'll have cones and pylons to indicate where assistants, whether they're retrieving for throws or assisting with strapping up the back of your racers. We'll have cones and pylons out to designate where they should stand when they're not supporting or not retrieving, just to ensure physical distancing. And as well, this is a big piece. athletes using either active hand gloves or, oh, it says harness gloves, and or tape should take gloves and tape off and on without using their teeth or mouth. So again, that's where we're gonna look for either assistance or really clear sanitation of those items. More specifically for wheelchair racing, so each athlete will be designated a lane with a preference of 1 lane gap in between athletes to maintain physical distancing. Athletes should only exit their lane when going on and off the track and to avoid any items in their lane. And athletes will not be allowed to draft at this time. So that's kind of where it'll look a little bit different in terms of wheelchair racing training. And again, that's not all the guidelines, but simply stuff that we're looking at right now. And it may change as we go and receive your feedback and as it goes through our board. So similarly for seated throws, athletes will be assigned a tie-down area while ensuring physical distancing, and each athlete will be assigned their own implements. So a big piece here where we see it sometimes in practice is that we use either some spit or we lick our fingers to get just a little bit of extra grip on that implement, but that's really what we're trying to avoid. So under no circumstance will we be seeing that at training practices for the foreseeable future. So again, just with these guidelines, they're not set in stone, and I really encourage, after hearing some of these, if you can get back to me with any feedback that you might have, because again, these guidelines are for you and our community and to keep everyone safe. So we're always looking for feedback around those. So with that, how can you help at this time? As we mentioned, the Return to Sport survey, pretty short to complete. If you could do that, that would be great. Practice good hygiene while at home. So frequent hand washing with soap and water and the use of hand sanitizers, avoiding touching your face, respiratory etiquette. So sneezing into your elbow or coughing into your elbow, or a tissue, and disinfecting frequently touched surfaces. At the same time, practice social distancing, so continue to stay at least 2 meters away from anyone you don't live with. Stay at home and self-isolate if you are experiencing any symptoms of a cold, flu, or COVID-19. So the bullet points that we had on the previous slide there. And again, how you can help, you ask questions and again, provide feedback, because we're here to help and we're here to make sure that we can return to sports. So with that, unless Gail has anything to further add, that's just a little bit of an overview of what the past couple of months have been for us and what we're working towards and what our guidelines are looking to incorporate. So again, the session was recorded, so I'm happy to pass off the slides to anyone that's interested. And again, if you have any questions, you can feel free to contact me anytime, as well as Gail if you have any other specific questions. We're both happy to help and support in this time. So if anyone has any questions, you can feel free to type them into the chat box right now, and we can kind of work through those. If not, again, I'll send a follow-up email just with some of the resources and what we've been talking about, and I can ask for questions at that time as well.
And there are currently no questions in the chat box, Anna.
I'll just, while people are thinking of their questions, just jump in here. Thanks, Anna and Gail, for putting all this together. It's really well done and presented very clearly, which there's a lot of information right now, so that's really important. So thank you for that. I do want to mention something to think about for both coaches and athletes, and just stop me if this has already been discussed in other forums, but that this is about the COVID related safety and health of our athletes. We also need to consider, in returning to sport, the other health and safety and injury prevention measures we need to put in place, given that we've had a very extended period of time with either no or modified training. So that's going to be very individualized depending on what an athlete has had access to during this time, but something that should be in the forefront of every athlete and coach's return to training plan. And I believe there are some resources starting to come out regarding that. So I'll pass that on to Anna and Gail if I come across any of those. And yeah, just again, it's going to be individualized. There's not going to be a one size fits all, but something to absolutely be proactively planning as we return to sport.
Yeah, thank you for that, Sarah. I think that's a really great point to add just in regards to injury and coming back to sport. So I look forward to getting that resource from you and sharing that. If there are no other questions at this time, again, just being cognizant of everyone else's day, I'm happy to end it here. Again, thank you everyone for joining for the hour today and just taking the time to learn of where we were and what's to come. And again, if you have any questions at any point, please feel free to email me or call me. I'm happy to support at this time. So thank you everyone, and we'll end the session here. And thank you, Sarah, for joining us from Athletics Canada as well. It was great to have you on for a national perspective.
Thank you.
Thanks for having me.